Hi, Dr. Siranand here. Okay, so today we're going to talk about cataracts, and some of the topics we'll be talking about here will be the definition of a cataract, what are the causes or risk factors for cataracts, some of the symptoms you may experience if you have cataracts, the types of cataracts, the investigations to diagnose cataracts, treatments that are available, and we can talk about the possible prevention or slowing down of the formation of cataracts. Okay, so before we delve into cataracts, let's talk a little bit about the eye anatomy so you'll understand where it is I'm coming from. So of course, this is a model of the eye. These here are the extraocular muscles. These are the muscles that will turn the eye left, right, up, down. Okay, and now just open this up a little bit. Okay, there you go. Good. So this here, that's the cornea. Okay, that's the first clear window of the eye. As you can see, it's curved, and this helps with the focusing of light as it enters the eye. Next part here, that's the iris with the pupil. The pupil is the hole. It is the iris that gives the eye its color as well. The pupil has the ability to get smaller and get larger. It all depends on where it is you're trying to focus. If you're trying to focus close by, it'll be a bit smaller. If you're trying to focus on an object in distance, it'll be larger. Then there's the lens. Okay, again, has a curvature to it. So light, of course, passes through the lens, hits the retina at the back of the eye. That's here's your optic nerve. All of the light information captured at the retina passes through the optic nerve, and this goes to the brain, where it is then interpreted. Okay, so that's basically how you see. This right here, these are the ciliary bodies, and these are muscles. So if you have an object close by, and you need to focus on that, and these muscles squeeze the lens and makes it thicker, so you can focus on an object that's close by. If the object is all the way in the distance, these muscles stretch the lens, makes it a bit thinner and longer, so you can focus in the distance. Cataracts really involves the lens. Okay, so a cataract basically is when the proteins and fibers of the lens break down, and they are no longer transparent, and they are rather opaque, and light doesn't travel very well through them. And that is what the cataract is. The cataract is that region of the lens that has an altered structure that takes it from being clear to being opaque. Okay, so now we're coming to the causes or risk factors of cataracts. So one of the risk factors would be age. So by age 40, what tends to happen is that the proteins and the fibers begin to break down, and they begin to clump together. And what you have is a clear lens turning into a more opacified or darkened lens, where the light doesn't pass through as it should. In diabetes that is uncontrolled, you have a deposition of sorbitol in the lens of the eye. And then what happens that this draws water into the lens of the eye, and the additional water, it will distort and disrupt the structures and the manner in which the proteins and fibers are laid out, leading to, again, the opacification or darkening of the lens of the eye. Excess UV exposure. So the excess UV, what it tends to do, it tends to damage the protein in the lens. Okay, and that leads to, again, a darkening or cataract formation in the lens of the eye. So if you're outdoors a lot, wear the proper protective glasses or the protective shades that would block the UV light. Smoking leads to a lot of what is called oxidative damage. A lot of free radicals are produced in the body when one smokes, and then this causes the free radicals cause a breakdown of the structures of the lens, leading to cataracts. The excess alcohol usage. So with the processing of alcohol by the body leads to a lot of free radical formation, and again, these free radicals damage the proteins of the lens, leading to cataracts. High blood pressure. Again, this leads to a disruption of the structure of the lens, leading to cataracts. I'll come to these two here in a while. Prolonged steroid usage. So if you have some sort of medical condition where you are using steroids for a prolonged period of time, the steroids, they tend to bind to the proteins in the eye and in the lens, and then this tends to disrupt the structure of the lens, leading to cataracts. Two other factors that can lead to cataracts is if you had a previous eye injury or some sort of inflammatory process or infection of the eye, and even previous eye surgery can increase the risk of cataracts forming. Okay, so let's take note of that. So now we're going to talk about the different types of cataracts. So I'm just going to do 3 general classes here. So there's first of all, the nuclear cataract. So with a nuclear cataract, that is where the cataract begins to form at the center of the lens. Okay? Cortical cataract, that's when the cataract begins to form on the rim, or on the edges of the cataract. And the posterior subcapsular, that's when the cataract forms on the back surface of the lens. Just want to talk a little bit about these two here, just to know how these two relate here. For example, now let's just say you go for an eye exam and you have a nuclear cataract. Okay, so that's the lens, and there's a cataract right in the center or close to the center. So that's a nuclear cataract, and the person looks at the eye and said, okay, you have a cataract, you're seeing this here. So let's say in a situation where you have cortical cataracts, where let's say a cataract just on the rim right here. Now, if the person doesn't do a dilated eye exam, okay, now with the dilated eye exam, that is when the eye drops are put into the eye to open the iris. You should remember from the anatomy lesson here, when you put the eye drops in, that dilates the iris, and then just here allows you to see. Yeah, look at that part. So some nervous around this. Some nervous around this. I'm going to press in first to the back. Look here. Yeah, fantastic. Okay, good. Let us. So I will. Okay, right, good. Okay, good. So this is the iris here. Now, when you put in the eye drops to do a dilated eye exam, what happens is it opens up the pupil, allowing you to see more and more of the lens. Let's just say the lens you did an undilated eye exam, and then you had a cataract forming on the rim of the lens. Obviously, if you're looking here and this is not dilated wide enough, you're not going to see a cataract or a cortical cataract just on the edge here. So let's keep that in mind. It's always best to do the dilated eye exam if you're going to be examined for cataracts, okay? Because the dilated eye exam will open the pupil wide enough, allowing the doctor to see the entire lens. Okay, I want to keep that one. I won't be controversial. I'll run that one by. So investigations and diagnosis of a cataract. So at our office, we do the dilated eye exam. And again, when I say dilated eye exam, that is where the eye drops are put into the eye to dilate the pupil so we can see the entire lens. And one of the solutions we use here is the tropicamide. See that there? Tropicamide 1%. Okay, that's one of a couple solutions that could be used to dilate the eye. And then here at the office, we have our eye specialists who come in and they use the slit lamp to examine you. So the doctor will be on this side using the lens to examine you. You will rest your chin here, and the doctor will instruct you to do certain maneuvers where he can examine the eye properly. And not just check for cataracts, but also other eye pathologies, even early signs of glaucoma, diabetic retinopathy as well. Okay, so the dilated eye exam has many uses. It can look for many conditions, not just cataracts. But you can investigate and diagnose cataracts using the dilated eye exam, again using a dilating solution and a slit lamp. So treatment of cataracts. Currently, the treatments available would be surgery, and in this particular surgery, a technique called phacoemulsification is used. What this is, it is an ultrasound device that is used to actually break up the lens, and then a vacuum is used to basically draw the lens out of the lens capsule, and an artificial lens is put in place of the original lens that was once there. So again, if we come back to the eye diagram here, the eye anatomy model. So for this procedure, you'll be awake, and what happens is the injections will be used to numb the eye and paralyze the eye muscles. And what's going to happen is the surgeon is now going to go through cornea, and you're going to use the ultrasound device to liquefy this lens here, as well as then use a device to suction out the liquefied lens. And then through that same incision, they are going to introduce an artificial lens here. So that's what cataract surgery is all about. Cataract surgery is about removing the natural lens and then replacing it with an artificial lens. So what can we do to help to slow down the formation of cataracts? Now, you may not be able to entirely prevent cataracts. It's said that if you are old, if you live long enough, you eventually are going to develop cataracts. But of course, everybody would like to at least take some measures to slow down the process, or when cataracts do come, that they're not as severe, needing surgery. So what we can do to help to slow down the formation of cataracts, of course, is get regular checkups, regular eye checkups, making sure that we catch problems early, quit smoking, reduce alcohol consumption, control your diabetes. This is very important. A lot of diabetics are uncontrolled in this country, and it does lead to blindness, and in addition to blindness, stroke, heart attack, kidney failure, foot ulcers, loss of limbs. Okay, so this is very serious. Of course, eat a wide variety of fruits and vegetables to get an appropriate amount of antioxidants in the body. Remember, free radical formation, oxidative stress, these are contributing factors to the formation of cataracts. So using a diet to help to reduce inflammation, oxidative stress, free radicals in the body would help with the slowing down of the formation of cataracts. So following through with the slowing down of the formation of cataracts, gave some typical lifestyle changes that you can make. But of course, everyone wants to know, what can I take? Are there any supplements I can take? I would definitely recommend you look into these three here. There are supplements available with the lutein and zeaxanthin. And this is an interesting one available in eye drops, the N-acetylcarnosine. I'll talk a little bit about this here. The carnosine itself, carnosine eye drops, were actually used in dogs, okay, that had cataracts. And this did seem to work for the dogs that had cataracts, and it was modified into N-acetylcarnosine for human use. Okay? This has to do with the different types of metabolism between dogs and humans. So you can do some reading on this here, N-acetylcarnosine, where it pertains to eye drops, cataracts, and overall eye health.
Contact us today, 747-5297 or 308-3370. We do eye exams in Pennywise Plaza, Chaguanas, and surgeries at Nova Medical Center, Mausica Road, Diabetic.